Hello, I'm Dr. Greg Parsons, Chester Family Chiropractic, and we take care of a lot of pregnant women here. And we have Marissa, who's joining me today.
Hi.
She is expecting mother and doing fantastic. And I wanted to go over, answer some questions, get a lot of questions about pregnant moms and compression in the low back and some stretching we can do to kind of alleviate that. And any pregnant mom can do this with assistance. And I'm going to demonstrate this on Marissa. And you've been doing pretty well with this.
I have,
at home.
yes. It has made
Do you mind
a huge
sharing a little
difference.
bit? About,
Absolutely. So I've been coming for at least 3 months now, and from the very beginning, the pain that I was feeling was excruciating. When I got here twice a week, I would come along with these stretches and some at-home icing, and I felt humongous difference within a couple of weeks. As moms, we want to have the best pregnancy we possibly can.
Mm-hmm.
This is something we could have control over if we come and we get help, and I would recommend it to anybody. I feel 150% better.
Yeah, and you've been doing very well with your adjustments.
Yes.
Sleeping a lot better, remember you telling me
Sleeping
that?
a lot better,
What are some other
picking up my
benefits you've had?
son a lot better,
Yeah.
doing daily functionings, chores, things like that, so much better than before. So I'm very thankful.
Great. Well, let's get to it.
Okay,
Right?
all right.
So we're going to put you in the proper position here.
Okay,
And
Like
we're going to
this
face
way.
this way. Yep.
got it.
So she's going to get into what we call sitting on her feet.
Mm-hmm.
And what I want you ladies to notice is her knees are apart here, which is going to open up the pelvis, and it's going to feel extremely good. And what we want to stretch out is this small of the back here. This is kind of where it gets cramped up and doesn't feel too well. Okay? As I'm doing this, it's going to traction out the low back, and it's going to alleviate the pressure that's here. It's also going to stretch the muscles out as well. Okay? So when someone, you can do this on your own, but it's not as effective as someone helping you out. Just to note, when I'm doing the stretch here, my hand is going to be positioned like this. Okay? I'm going to use this hand though, but I want to show you with this hand real quick. The angle of her glutes comes down at an angle like this. So my hand has to be like that, pushing this direction. We don't want to go straight across, and we don't want to come straight down, because all that's going to do is just jam up this area, and it's not going to feel good. So Marissa, why don't you do this? We're going to take a deep breath in. You're going to blow it all the way out. And then as she's doing that, it's just a nice, gentle stretch, just like that. How does that feel when we do that?
Great.
Good. So why don't we get a little closer here? So the spine is here, and then what we call the sacrum here, which is this part. Let me get this here. Let's put this on here. So this is the sacrum, and this is the lumbar spine right here. My hand is on the sacrum, so it's on the tip of the sacrum going like that, okay? And we're going straight down at an angle. We're not coming down. You can notice if I went straight down, it just kind of jams up this area, and it's very uncomfortable and counterproductive. So what we want to do is, again, hand is right here. Deep breath in all the way out. And the reason why I have her do a deep breath in all the way out is she can get deeper into that stretch. And I'm not pushing very hard at all. It's very gentle. You can also do a counter stretch here where you're kind of just tractioning out and isolating this lumbar spine even more. How does that feel when I do that?
Great.
Great, yep. Now, if you wanted to do this on your own, you have no one helping you out. What you would do is deep breath in again, blow it all the way out, and you want to try to just sit on your feet as best you can. You can also widen out your legs if you want. We have a table here, so we're a little limited, but you can see how it just opens up the pelvic area even more and takes pressure off the belly and also the low back when she does that. You can incorporate ice with this if you want to as well.